Welcome back. The time now is 6:48. Coronavirus back on the rise in Kern County. Although it is a small spike, local health experts are concerned this could be another big surge.
And joining us this morning, Corson, public health spokeswoman, to talk about the warning that we heard earlier this week from Public Health Director Brent Kerrigan to Kern County supervisors, kind of sounding the alarm. Michelle, thanks for being with us, first of all.
Thank you for having me.
So this is a spike. We're definitely seeing an increase in cases, but it's still such a small spike if we look at where we've been. Why is everyone still so concerned about this trend?
And I think you bring up a good point. When we look at what the winter surge was, for example, we are far below that. However, we are seeing some very stark increases over the past 2 to 3 weeks in particular that are very startling. You know, we have doubled our case rate each week the past several weeks. So what we are seeing is a steep increase, which is absolutely concerning to us here locally and at the state and national levels.
And I know there's been a big message, a big push to get people vaccinated. The numbers look good, just the raw numbers look good in the sense that we have 316,000 people in our community that have been fully vaccinated, which sounds great, but when you look at it on a broader scale, when you put in the number of people not vaccinated, it seems a little bit more concerning.
Yes, you know, at the state level, about 62% of folks that can get vaccinated are vaccinated. In Kern County, it's just over 41%. So we have some work to do, absolutely, to get that community immunity that really will help us move forward and stay safe as a county.
Now, you know, we're back open. Masks have come off. We thought that we were done with this. Yet we're talking about this surge again. What should we expect going forward in the next couple of weeks and months? Is this something that even your health department, the local health department, is saying, okay, you know what, this is definitely not over?
Yes, we are concerned, obviously, and the numbers are kind of speaking for themselves. And we are dealing with these new variants. You know, viruses are adapting. This virus is adapting to its environment. It wants to survive and thrive. So unfortunately, that's where we're seeing these variants that are now more transmissible, causing more severe illness and even death. So this is nothing to take lightly, and we all really need to arm ourselves and protect ourselves individually and really as a community.
You know, speaking about vaccines and the number of people who are vaccinated, there is a lot of hesitancy out there. And one of the biggest things I hear is for young, healthy people, you know, the majority are fine if they get COVID-19. So why do they need to get a vaccine?
You know, it's interesting, and that's a fantastic question. The American Academy of Pediatrics just came out and said 22% of all of the new cases are in our children, 18 and younger. This is impacting our children at a higher, quicker rate than it did previously. Why is that happening? Are the variants playing a role? These are all things we're learning. And our young people are also transferring this virus. And again, that impacts all of us and the more vulnerable. So again, it goes back to we all kind of have that responsibility. We all play a role in protecting ourselves.
So you're not just getting the vaccine for yourself, you're getting it for the people that you could potentially come in contact to.
Absolutely. You know, this is our time to work as a community together collectively. You know, they're back years before us, there was the measles vaccines. There's been vaccines developed over time, and we have benefited from that science, and we have built upon it. And it is absolutely incredible that we have 3 vaccines that are safe and effective now. That it's a fantastic offering for folks.
You talk about effectiveness, that they are effective vaccines, but a lot of people are going, how are they effective if people are still testing positive for coronavirus even after being fully vaccinated? Here in Kern County, you know, according to the last update, 124 people in Kern County have been fully vaccinated and still contracted the virus. So how can they still be considered effective if people are still getting sick?
Well, and that is a great point. Yes, there are people, it is a very small amount of people that are still getting the virus. What is really critical is the vaccines are helping to prevent severe illness. That is so important. Getting something is one thing, but getting hospitalized and dying from something is another. And that's what the protection that these vaccines are offering us. And I think that the families, you know, over 1,400 individuals lost their lives in our county. Those families, you know, viewers listening right now, I think it's important to know there are things to help protect us, because this virus has impacted us for sure.
All right, really quickly, where can you get a vaccine?
You go to kernpublichealth.com, and we still have a live interactive map. Vaccines are plentiful. They're everywhere. And at Public Health, we have our clinic that is open Monday through Friday. You can walk in. They're free, and we'd love to see you.
And there's still testing going on along in the county as well, so don't forget that as well. Michelle Corson, as always, thanks so much for joining us. Do appreciate it.
Thank you. Thank you.
All right, we're back with more news next.